Hi, my name is Nikki, and I want to share with you how I found out that I had an autoimmune disease diagnosis, lupus. Lupus is an autoimmune disease that your body fights itself inwardly. Some of the symptoms you may see externally, like skin disorders. Some things happens to the body internally, which affects your organs, your kidneys, your lungs, those type things. So back in, and I have my notes here, so you may see me looking down. I just want to try to remember to get all of the details, tell you everything. So my journey started around somewhere between 2004, 2006, when I got the initial diagnosis. However, I think the initial diagnosis was in 2006, but prior to 2006, I had been having various symptoms. I experienced like my hair thinning because I've always had long, thick hair. And I would notice sometimes when I combed my hair, more than normal hair would flake out, fall out, or whatever. And I used to wear my hair in a ponytail quite a lot. And my ponytail, I could run my hand through my ponytail and I would have a lot of hair. I paid it some attention, but not a whole lot, because I thought my hair was just going through the process of normal shedding. And I know that, sometimes they say that your hair sheds 100 strands a day. I don't know. I was kind of, I can't say I wasn't worried, but I wasn't worried so much that it was constantly on my mind, nothing like that. So, in 2006, I was out of town for an extended amount. As a matter of fact, I was working out of town. And when I was out of town, I went to found a local hairdresser to get my hair done. And in the process, when you go, most of the time when you go to a new cosmetologist or what have you, they do a brief consultation analysis of your hair. He was asking me if I had any problems. I told him, no, not a lot of problems, but I did notice that my hair was thinning. Where I had the long hair, what I mentioned about the ponytail, that type of thing. And he said, yeah, sometimes, excuse me, you can get a bad batch of relaxer. And so I just thought maybe I got a bad batch of relaxer, and as my hair grew out, the damaged pieces of hair, whatever, would be replaced by stronger hair. So later in 2006, I started having like some foot pain, and it felt like if you, in my hands too, and it felt like if you tied a rubber band as tight as you possibly could around your fingers or around your toes, and the pressure, that's the only way I really could describe the pain. So I went to the doctor and I told my doctor about it, and she said maybe it was plantar fasciitis, and she gave me some type of foot brace when I go to bed at night. And the foot brace, if you can think of what an L looks like, and my foot, I would put it on, and my foot, it would be on my foot like this. So my foot was here, right here, and this part was my leg, so that she wanted my foot to be like this. And she also had me go to an orthopedic doctor, and they gave me a foot brace to try to relieve some of the pressure. I did that for a while, and the splint, talk about the splint. So in another visit to my doctor, but prior to that visit, I was also sent to, I forgot the type of doctor, because my doctor thought I may have had Raynaud's, which is some sort of, I guess, diagnosis that you have your fingers turn blue. My fingers were getting blue, and I had a numbing sensation. And I went to that doctor as well, because I'm like, maybe this is what's wrong. They will find a solution, give me a treatment, I will be okay, send me on my way. Went to that doctor, got the results back. That wasn't what was wrong. So then on another visit to my doctor, I had some blood work done. I guess they did a complete blood count, whatever they do when they do a complete lab work, blood work for you. So had that done, and then I had to go back to the doctor for the results. And there are a lot of pieces I may be leaving out because there's so many details to get to this point. Just want to give you an overall view of of what happened. And as we proceed on the channel, and as I talk about different things that I have experienced along that are the result of the disease or the diagnosis, we'll talk about those in different phases. But now I just want to talk about how and when I found out. So I talked about my hand, and back to my primary doctor for my blood work results. So I go to the appointment, and I see she had a physician assistant. So I go in, and that's who I saw that day. So I have been going to this same doctor for about 20 years. So they had all of my blood work, lab work, everything I've have done for at least the past 20 years. So my doctor is really good. I like her. She always has been a caring doctor. So that's the most important thing for me. Advocate for myself. She advocates for me as well when things are, above my level, above my lane. She takes the lead and gets things done. So I really have appreciated that over the years. And now I also appreciate the things that she's done to, help. So the PA came in, and she greeted me, and she was thumbing through my file, and she says, "I'll be back in just a minute." So she left, and maybe about 5-6 minutes she came back. So when she came back, she looked a little funny in the face, and I'm like, what's the deal? So so she said, I hate to tell you this. And I'm like, hate to tell me what? Because when a doctor starts delaying what they're trying to tell you, it makes your heart beat fast, and you don't really know, like what's going on. But she said, "I really hate to tell you this." She said, "I left the conversation with the doctor to make sure that these were your results, and that, hey, this is you." So turning to the next page so I can make sure I have all my stuff together. She said, make sure that these are the results. And they were. And at that moment, like I said, I didn't know what to think, how to think, what was going on or whatever. So she said, "I really hate to tell you this, but you have a lupus diagnosis." And I'm like, it's okay, because not that it was okay, but it's okay for you to give me my diagnosis, because now, we need to proceed to see if we can, what the treatment is going to be. So, and at the moment, other than that, I really didn't know what to say, because once she gave me the diagnosis, I don't remember her giving me any resources. Maybe a piece of generic literature or something like that, but I don't really remember her providing me with any resources, any groups, support groups that I could go to and talk to about this or whatever. Just comforting from the doctor or whatever, and those type things. Almost like at that moment, it was almost like she wasn't my doctor, more so like she was a friend, and she was comforting me after having to give me, some maybe unpleasant news. But it was okay. But the one thing that they did do, they made sure that I had a referral to the rheumatologist. And I guess in the area, there are not a lot of doctors who specialize in rheumatology and who specialize or have the necessary skills to treat patients that have autoimmune diagnosis. So she did give me one. She gave me the first doctor that I went to, who had some availability, and some of the other ones that she was recommending, they had a long wait for patients or whatever. So I had made an appointment with this doctor, the rheumatologist, and they asked me a few questions. I went back to see the doctor, and he did a quick evaluation and gave me a prescription. Before I leave, I make my follow-up appointment. And so I would see this doctor every 4 to 6 weeks, and pretty much the same thing would go on. I would sign in. I don't ever remember having a urine analysis done there, but pretty much the same thing would happen. I would go sign in, go to the doctor. He would hit my knee with something, ask me how I felt. I told him I felt okay. Asked me if I need any more medication, did I need a new prescription. If I did or didn't, I let him know. If I did, then they wrote me another prescription or whatever. And so this cycle went on and on for about 6 months to a year. And the prescription that he was giving me, I don't know if that medicine was pain or something. I can't remember. Maybe it was something for pain. I think that's what it was. He was giving me medication for pain. So after about 6 months, maybe 6 months to a year of seeing this particular doctor, I had to go and see my primary doctor for an appointment. We discussed the care that I had been receiving at the rheumatologist, and I told her about the appointment and about the prescriptions that he had been giving me each time. She asked me more questions and different questions or whatever, and the more questions she asked, she was hearing, I guess, whatever responses I was giving her. Those were the responses that were good enough for her to feel that I needed to have a new rheumatologist. So no, he wasn't doing any blood work. No, he wasn't doing urine samples. Just a lot of no's to every question that she asked me about what was happening at that rheumatologist. So she was getting aggravated, probably a little more than aggravated. I think she was mad because of everything that she was asking me. I was telling her no, because those were not things that were happening at the doctor. So she left the room, made a few calls, and got me in to see another rheumatologist. And I think that visit probably came maybe within 4 to 6 weeks, which was the time I would have seen the original rheumatologist. So I was doing fine. In a few months, I was doing fine or what have you. So let me make sure I got because I got all this stuff written down. So once I got to the first appointment with the rheumatologist, oh my God, it was a very, very, very thorough appointment. And so now looking back, I understand why my primary doctor was so upset with the initial treatment that I was receiving at that rheumatologist. The new doctor, that first appointment that I had, it lasted no less than an hour. They were asking me all type questions. They did blood work. They did urine samples. They did a really, really, really intense evaluation and consultation. They gave me medication for steroids. They gave me medication for maintenance to other medications to control the disease. So my follow-up appointments with this doctor, I think they were probably monthly to 6 weeks. The same routine. I would get a weigh-in. I would get a blood result. I would get lab work done, and then they would give me. I would have to do a self-analysis, and I may have done a self-analysis, at the first rheumatologist. And that analysis is to ask you how you feel. Do you have any joint pain? Can you button your shirt without help? Those type things. So the follow-up appointments, they were asking me, do I have any flare-ups? Or the self-analysis would indicate whether they should be concerned about flare-ups or what have you. So this rheumatologist that I've been seeing, they do the bone density scans, all different type of treatments, all different types of things that can be done to help my diagnosis so that I wouldn't have a lot of issues. So I've been seeing this doctor for at least 10 years or so, and they monitor my condition or the diagnosis really closely. The doctor, she's an older doctor. She's really, really concerned, shows concern, and is concerned with her patients. So another thing this doctor did was require me to have a routine appointment with an ophthalmologist, not an optometrist, but an ophthalmologist, someone who studies the eye, any eye diseases, those type things. So, and I see this doctor to make sure that the medication that they give me does not affect my eyes negatively, because I think this medication may impact the eyes on some patients. So far, I haven't had any problems with my eyes taking the medication. So As a matter of fact, not only do I have this rheumatologist that is on board with my care, I have a team of doctors who work together to make sure that I'm in the best health possible. And for that, I am, thankful. So I've had a lot of flare-ups. Well, you know what? I've had a lot of flare-ups, but I think the lot of flare-ups that I've had are minimal compared to a lot of other patients. So I'm thankful for that too. I've had some challenges, some other health issues that have been are the result of having this diagnosis. And those are things that we will eventually talk about over time. And the story of my diagnosis is just an introduction to me and some of the things that my channel will talk about. We won't talk about all things lupus, but I know that it's important for me to share how I navigate life having this diagnosis. And there'll be more. We will talk more about the diagnosis and the different challenges that I've had living away from family with the diagnosis. So it will be a lot of things that I will share with you. And if there are things that you find that you are interested about, that I may be able to help you with, or I may be able to share my own experiences with, drop them down in the comment. And I encourage you to like the channel. I encourage you to subscribe to the channel, share the channel, and hit the notification bell so when I update or make any new videos, upload new videos, you will be notified that that is there. Drop a comment. Like I said, drop a comment below. We'll talk about how I am able to navigate life with the diagnosis. Again, I ask you to like the channel, subscribe to the channel, hit the notification bell, and down in the comments, drop some comments down in the chat box or in the comment box to let me know what other content that you would like to see on the channel. Right now, I'm new at doing this, so it will take me just a minute to get the hang of it, but I look to drop new videos at least once a week. And as I get more experience with this, you may see more video content, maybe twice a week, but we'll see. I thank you all for taking the time to listen to my story of how I found out that I had an autoimmune disease diagnosis. So until next time, have a good week, and I'll see you here again in the next one. Have a good one. Bye.